Hello everyone, welcome to the ophthalmology session. I hope you all are prepared and excited for the one-shot session for FMG ophthalmology. Hello everyone, welcome to the session. Can I get a thumbs up if my audio and video are clear, if we are good to go enough? Hello everyone. Hello Aarti, Fayed, Sheikh. Hello everyone. Vijay, hi. Good evening. So, how are you all? And I think and I hope that you people are as excited as me for this ophthalmology session where we are going to cover all the important topics of FMG ophthalmology in the form of the questions. Hi, hello everyone. If my audio video is clear, can I get a thumbs up? Very, very good evening. Warm welcome to all of you. So I have taken care that we are going to cover all the important topics of the ophthalm, and I have taken this in the form of questions because when you read the theory and when you apply it to the questions there is a difference. So we will try to apply that knowledge also to the questions. Yesterday's session was awesome. Oh, thank you so much. I am really humbled. Um, Very clear. Okay. So the very, very important question, let's get started from the question number 1. Okay. So this you can see is an important question. Retinoscopy is being done from a distance of 1 meter and the drug which they have used is atropine and they are asking you the prescription. Okay? Now first of all remember the formula refractive error is equal to retinoscopy minus the distance factor. You have to reduce the distance factor from this and also minus the tonus. So first of all, you should know the formula. This is very, very important. This is the retinoscopy which they have given, the distance factor and the tonus. Now, what is the distance factor? When you want to calculate the distance factor, it is equal to 1 upon the distance. And this distance will be taken in meters. Distance factor is equal to 1 upon distance in meters. So here it is 1 meter, that is equal to 1. Okay? So here our distance factor is 1. Now second is tonus. Tonus is different for the different drugs and this you have to learn. So for this you can remember the mnemonic acetylcholine. ACH hota hai na, acetylcholine. It is 1, then 0.75 and equal to 0.5. And mostly they are going to give you these only because it's easy to calculate from them, having a calculation between 1 hai, 0.75 and 1. So this is quite easy. Okay. So we are taking it as the 1 here because atropine is 1 and they are saying that they are taking the atropine. Okay, they are using atropine. So now if you see the retinoscopy that they have given is plus 2.5 and plus 3.5. So this is plus 2.5 and this is plus 3.5 minus the distance factor minus the tonus. Minus the distance factor minus the tonus. Please see if you have understood this formula hai, distance factor hai, tonus hai and reduction. Due to which I am going to get plus का 0.5 है ना, 2.5 में से minus 2. Now 3.5 में से minus 2 plus 1.5. Yes. Now see what you have got is plus 0.5 and plus 1.5. Now once you get this, now you will give the prescription. When I want to give the prescription or equal to refractive error, then anyone take it as diopter spherical and anyone take as diopter cylinder. Anyone you can take it as a spherical power. So plus 0.5 diopter spherical and then you have to take 1 as the spherical, and second I have to take cylinder minus spherical. So cylinder is here 1.5 and minus sphere is 0.5. Okay, this you have to give as diopter cylinder. Cylinder may, whenever you give the power, you have to reduce the spherical power at. Now, how many degrees? See, power of the cylinder is always given at 90 degrees. So, I have to give at 180, then I will give at 90 degree. So, this will become plus 0.5 diopter spherical, and then we have plus 1 diopter cylinder at the 90 degree. This is one of the prescription that I can give. Okay. Now I can take the other way also. I can take this as diopter spherical. So if I am taking this as diopter spherical, then it will be plus 1.5 diopter spherical, and then I have to reduce a cylinder minus sphere. So now cylinder is this. Now the cylinder is this, that is 0.5, and sphere is 1.5. So now it will become minus 1 diopter cylinder. And because now this is your cylinder and you want to give at 90 degrees, so again I will give at perpendicular axis. So now I will give at 180 degree. These are the two prescriptions that you can give. So any one which is available in the options, you can give it as the answer. Please see if you have understood this. Okay, so you have to change this sign and you have to change this degree. Simply you will get the answer. So see, I have got this one. I have got minus 1 at 90, plus 1 at 90. So this the answer will be plus 1 at 90. Therefore answer will be this. Either it is the minus 1 at 90 or it is either it is plus 1 at 90 or a minus 1 at 180 degrees. So I have now here plus 1 at 90. All them are 90 degree. So 90 degree pe I will take the plus 1. Okay. So this is your question number 1. Important question from the last 2 years. We are getting something like this. Even if you look at the NEET paper, they had given the question on astigmatism. So there is a pattern in their mind going on, and one numerical of this sort will always be given to you. So please see if you have understood this question. Very, very important. All right. Now coming to the next very important question. Again, a very, very must. Every year you get this question. We have a 12 years old boy coming with the injury of a cricket ball. Can you answer this question, guys? Next day, he is developing the diplopia in the upward gaze, headache, dizziness, vomiting hair, then bradycardia, hypotension, no congestion or proptosis. What is the most probable cause? What is this? Very, very important. Can you see? This is the teardrop sign. Teardrop sign, or it is also called as the hanging drop sign. Hanging drop sign. Teardrop sign or hanging drop sign. So where this is seen in the fracture floor of the orbit. So what is the name of this? This is the blowout fracture. Blowout fracture pe there was a question in FMGE 2023 also, a very, very important question, a NEET PYQ also, and it is occurring in the blunt trauma. Yes, it is occurring in the blunt trauma. You can revise the entire ophthalmology in this session with the help of these questions. The name of the sign ho gaya, name of the trauma. Then can you tell me the investigation of choice? Investigation of choice will be the X-ray orbit. Investigation of choice is the X-ray orbit. And what is the view? It is the Waters view. So patient should be standing in such a way as if, you know, he is drinking water like this. So when we are drinking water, the rays will come directly penetrate the inferior wall. Very, very important. Blowout fracture. We have got the Waters view, blunt trauma, hanging drop sign, or the teardrop sign. Now, what are the other signs? Other signs of the blunt trauma may we can get the subconjunctival hemorrhages. First of all, subconjunctival hemorrhage hai. Number 2 may you will get the raccoon sign, which is also called as panda sign. Always remember raccoon sign or panda sign. Then what about number 3? We can also get the hyphema. Hyphema is blood in anterior chamber. We can also get hyphema, which is the blood in the anterior chamber. And then number 4, very, very important, the Vossius ring. Very, very important is the Vossius ring. Vossius ring के बाद we will also have the Berlin's edema. Berlin's edema is found in the macula, and this is going to give us the cherry red spot. This is going to give you the cherry red spot. So all these are important with respect to the blunt trauma. 4.2 TNT cover we can do useful for the January examination. Yes, definitely you can use. All right. So second important topic hai ye for this. Now see the third one. What is the angle which is subtended by the topmost letter of the Snellen's chart at a distance of 6 meters? Now again we have a simple formula that each letter makes 5 minutes of the arc. Each letter will make 5 minutes at the respective distance. Okay. So if I am talking about topmost letter, that means it is 6 by 60. So this will make 5 minutes at the how much? At 60 meters. So Priyadarshini, that is why I have kept this question. Please be very, very alert. 5 minutes hota hai beta, but that is at 60 meters and they are asking at 6 meters. So we are coming closer. We are decreasing the distance to 6 meters. That is 10 times. The patient is coming closer by 10 times. Therefore, angle will increase by the 10 times. Therefore, angle will also increase by 10. So it is 5 into 10. This is equal to 50 minutes. That is why the answer is not 5 minutes. Answer is 50 minutes. So whenever they are asking you, always see what is the angle made at the respective distance and what is the angle made at 6 meters. Yes. Can you tell me the same question now for 6 by 36? So if it is 6 by 36, this will make 5 minutes. 5 minutes at the 36 meters. So what is the angle at 6 meters then? So we are coming closer by 6 times. 6 times. Therefore 5 into 6. This will be 30 minutes. Similarly, if they are asking for 6 by 24. So 24 by 6, we are coming closer by 4 times. Therefore 5 into 4, this will give us 20 minutes. 20 minutes. If I am asking for 6 by 18, so 18 by 6, this is equal to 3 times. So here we are coming closer by 3 times. So 5 into 3, this is equal to 15 minutes. This is how. And if I am talking about 6 by 6, then the answer is 5 minutes only. Please see if you have understood this. So another important topic is the visual acuity. Then next, corneal endothelium is derived from. In prescription, we have to correct the power. Yes, yes. That is the refractive error. How much refractive error the person is having. Okay? So here we are talking about the embryology or the development of the eye. Okay na? So development of the eye will start at the 3 weeks of the gestation. It is starting at 3 weeks and it is complete by the 9 to 10 weeks. It is completing, and the gene which is responsible is the PAX6 gene. Always responsible is the PAX6 gene, and it is developing from 4 structures. This is another important thing. So there are 4 structures from which the eye will develop. One is the surface ectoderm. Then number 2 is the neuroectoderm. Neuroectoderm. Then is the mesoderm. And number 4 is the neural crest. Number 4 is the neural crest. These are the 4 things. So if I talk about the surface ectoderm, what are the derivatives of surface ectoderm? Always remember the mnemonic L3E square, L3E and C square. Now out of this, what are the things that you have to include? L. So L for lens, then L for lids, and L for the lacrimal apparatus. And also L for lacrimal apparatus. Yes, the mnemonic is L3E and C square. Then E for epithelium of the 2C. One is the cornea and one is conjunctiva. So with the help of this mnemonic, you can easily remember the surface ectoderm. Then we are talking about the neuroectoderm. What are the things which will come from neuroectoderm? So it is the nervous cord. Nervous cord में you will have the retina and the optic nerve. Retina है, optic nerve है. Then we have secondary and the tertiary vitreous. Secondary and the tertiary vitreous which are present after the birth. Then we also have the what you called as the smooth muscles of the iris. Smooth muscles of the iris also have the neurological function because they will help in pupillary constriction and pupillary dilatation. And then we have the epithelium of the remaining things, that is the iris and the ciliary body. Now out of this, the smooth muscles of iris is really important because ideally muscles should come from mesoderm, but here muscles are not coming from mesoderm because they are not having the function of motility, rather they are having the neurological function of the pupillary constriction and dilatation. That is why they are coming from neuroectoderm. Then number 3, what are the things which are coming from mesoderm? Mesoderm say first of all is the primary vitreous. You have already seen that the secondary vitreous and tertiary vitreous were coming from neuroectoderm. From the neuroectoderm, while mesoderm से primary vitreous है, then very important extraocular muscles. We have got the 7 pair of extraocular muscles. Then we have the choriocapillaries, all the blood supply. Choriocapillaries will come from here. Choriocapillaries. Then we have this one, endothelium, because endothelium is also representing the mesoderm. So we have endothelium, and apart from this, we are also having the temporal sclera. Not whole sclera, it is only the temporal sclera. Only the temporal sclera. Then after this, what is the next thing? Next is the neural crest. Next is the neural crest. So talking about the neural crest. D is the neural crest. Okay? Now neural crest will have 2 parts. One will be the mesenchymal and one is the neural part. One is mesenchymal, one is the neural. And neural say we have got the melanocytes. And we also have the Schwann cells, only 2 cells from the neural part and rest is from the mesenchymal part. Like we have orbit here, we have got trabecular meshwork, very important is the trabecular meshwork. And another important thing is the ciliary muscle. Now can you see we have got 3 kind of muscles. One is the extraocular muscles responsible for motility coming from mesoderm. One is the smooth muscles of the iris responsible for pupillary constriction and dilatation coming from neuroectoderm, and third is your ciliary muscle helping in accommodation, therefore coming from neural crest. And then we have the sclera. Now sclera may it is all except the temporal because temporal has already developed from the mesoderm. Then also we have corneal endothelium. Talking about the corneal endothelium where they are asking you the question. So whole of the endothelium is coming from the mesoderm while the corneal endothelium from here. And third we talk about the stroma. So stroma of the choroid is coming from here while the choriocapillaries were coming from mesoderm. So these 3 are most important. ये 3 most important है. Please see, because they are developing from mesoderm as well as neural crest. So these three are most important. क्यों? क्योंकि sclera, whole of the sclera will come from neural crest, but the temporal sclera will come from the mesoderm. Then secondly, agar they are saying the endothelium, then endothelium is coming from mesoderm, corneal endothelium is coming from the neural crest, choriocapillaries are coming from mesoderm, while the choroidal stroma is coming from the neural crest. Hi Abhishek, welcome everyone. Chalo, next. Now, a must question for your exam. Must question. Cause of decreased vision due to the defection. What is this? Who will tell me ये क्या है? What is this, guys? Diagnosis बता दूं, then we will talk about. Identify the image. What is this? Yes, this is the pterygium. This is the pterygium. Pterygium क्या होता है? It's a degenerative condition. Degenerative condition of the conjunctiva, where we are having the wing shaped fold of the conjunctiva over the cornea. When we are having wing shaped fold of the conjunctiva over the cornea, then this can lead to irregular surface of the cornea. And due to this irregular surface, what can happen is the astigmatism. So the most important cause of the diminution of vision in this patient is astigmatism. Please remember, the type of astigmatism is with the rule astigmatism. The type of astigmatism that you are going to get is with the rule astigmatism, means vertical curvature will be more than the horizontal. ठीक है? This is one thing. Then it can also cause the obstruction, obstruction of the pupil. It can also cause obstruction of the pupil. So that is also one of the causes for diminution of vision. But the most common will remain the astigmatism only. ठीक है? Now coming to the treatment. इंग्लिश में भी पढ़ाई है. ओके, ट्रीटमेंट बताओ. ट्रीटमेंट क्या करेंगे? इफ वी आर हैविंग अ ग्रोथ ओवर द कॉर्निया, व्हाट वी आर गोइंग टू डू इज सर्जिकल एक्सcision. But whenever we are doing surgical excision, what can happen? We have the recurrence. So up to 80% chances क्या हो जाएंगे of the recurrence. Now how can you reduce the recurrence? Reduce the recurrence. Yesterday जो मैंने सेशन लिया था उसमें आई हैव कवर्ड द न्यूरोऑफ्थल्मोलॉजी एज वेल एज दी स्क्विंट. तो एक बार आप वो वाला सेशन भी देख सकते हो, बिकॉज आई डोंट थिंक कि 1 hour में एवरीथिंग स्क्विंट, कैटरेक्ट, ग्लोकोमा, एवरीथिंग वोंट बी एबल टू कंप्लीट, है ना. तो व्हाट वी कैन डू टू रिड्यूस द रिकरेंस, क्या क्या यूज कर सकते हैं? वी कैन यूज द मीटोमाइसिन सी, और हम यूज कर सकते हैं थायोटेपा. नेम ऑफ द ड्रग सारी पता होनी चाहिए. कंजंक्टाइवल ऑटोग्राफ्टिंग हम कर सकते हैं. ऑल दीज आर वेरी इंपॉर्टेंट PYQs. फिर और क्या कर सकते हैं? वी कैन emit the beta radiations, and then we can also do the amniotic membrane grafting. एमनियोटिक मेम्ब्रेन का ग्राफ्टिंग कर सकते हैं. अब ये सब कुछ मैंने बता दिया. कैन यू टेल मी व्हाट इज स्टॉकर्स लाइन? वो यू पीपल हैव टू टेल मी. स्टॉकर्स लाइन बताओ, because these three things are most commonly asked in pterygium, है ना. Number 1, the most common cause of diminution of vision. Number 2 about treatment, and number 3 is the Stocker's line. कौन बताएगा? Today second lectures, ma'am. Yesterday also हाँ मैंने एक सेशन लिया था जिसमें आई हैव टॉट द थ्योरी. वो वाला सेशन भी जाकर देखना. यू विल गेट दिस. एंड वो 2 hour सेशन था जिसमें आई हैव टॉट द what you called as the squint as well as neuroophtha. I will try my best to share the PDF. ठीक है ना, लेकिन पीडीएफ का वेट मत करो, अभी अटेम्प्ट करो, अभी रिवाइज करो। चलो, स्टोकर्स लाइन क्या होती है वो बता दो। स्टोकर्स लाइन इज ड्यू टू दी आयन डिपोजिशन। स्टोकर्स लाइन हो जाएगा ड्यू टू दी आयन डिपोजिशन। केएफ रिंग होता है, फ्लेशर्स रिंग होता है, एंड स्टोकर्स लाइन। केएफ रिंग इज फाउंड इन विल्सन्स डिजीज, फ्लेशर्स रिंग इन केराटोकोनस एंड स्टोकर्स लाइन इन टेरिजियम। ठीक है, चलिए आगे। नेक्स्ट वाला फॉल्स अबाउट द बाइटॉट स्पॉट्स। क्या होते हैं बाइटॉट स्पॉट्स? बाइटॉट स्पॉट्स आर फाउंड इन आर द वाइट foamy spots। वाइट फोमी स्पॉट्स होंगे in the vitamin A deficiency. They are reversible on treatment and they are first found on the temporal conjunctiva earlier than the nasal conjunctiva. And why we are getting this? So basically what happens in vitamin A deficiency, what is the earliest symptom? Earliest symptom that you are going to get, क्या मिलेगा? Always see कि earliest symptom पूछा है, earliest sign पूछा है. Symptom will be the night blindness. Earliest symptom हो जाएगा night blindness. And if they are asking earliest sign, तो क्या मिलेगा? Earliest sign में conjunctival cirrhosis सबसे पहले मिलती है, कंजंक्टाइवल सिरोसिस, देन इज द बाइटॉट स्पॉट्स जो कि व्हाइट फोमी स्पॉट्स होंगे, मोर कॉमन और टेम्पोरल साइड होगा, एंड उसके बाद मिलता है कॉर्नियल सिरोसिस। तो जब भी हमें ये जीरोसिस मिलेगा, व्हाई वी आर गेटिंग दिस? जीरोसिस मतलब ड्राइंग होता है, दिस इज ड्यू टू द चेंज ऑफ एपिथेलियम। चेंज ऑफ एपिथेलियम है फ्रॉम द नॉन केराटिनाइज टू द केराटिनाइज। तो नॉर्मली हमें जो एपिथेलियम मिलती है वो कैसी मिलेगी कॉर्निया कंजंक्टिवा में? नॉन केराटिनाइज स्ट्रैटिफाइड स्क्वैमस, वो चेंज हो जाती है टू केराटिनाइज। तो केराटिनाइजेशन की वजह से मिलते हैं ओवर द कंजंक्टिवा। कौन से कंजंक्टिवा पे मिलेगा? इट इज फर्स्ट फाउंड ऑन द टेम्पोरल साइड ऑफ द कंजंक्टिवा, रिवर्सिबल होता है। बाद में from the corneal cirrhosis this will go to keratomalacia and keratomalacia से finally हो जाता है xerophthalmia, scarring fundus, ठीक है ना, xerophthalmia। तो this is actually irreversible, xerophthalmia फिर irreversible हो जाता है। हाँ, ये फेवरेट क्वेश्चन है, बहुत ही इंपॉर्टेंट है। अर्लीस्ट सिम्टम, अर्लीस्ट साइन, रिवर्सिबल, इरिवर्सिबल, विटामिन ए डेफिशिएंसी। आंसर कौन बताएगा फिर इसका? हाँ, ये हर बार आता ही आता है। इमेज आता है बाइटॉट स्पॉट्स का, इमेज भी मैं अभी दिखा देती हूँ, पहले थ्योरी भी डिस्कस कर लेते हैं। व्हाट इज फॉल्स अबाउट बाइटॉट स्पॉट्स? इट इज ड्यू टू द केराटिनाइजेशन ऑफ द एपिथेलियल डेब्री, ये ट्रू है। अपीयर्स ऑन कंजंक्टिवा, ये भी ट्रू है। एंड xerophthalmia में डेवलप हो जाता है, देयरफॉर आंसर हो जाएगा सी, इट इज नॉट अपीयरिंग ऑन कॉर्निया। नॉट अपीयरिंग ऑन कॉर्निया, रादर कहाँ डेवलप होता है? ऑन द कंजंक्टिवा। ठीक है, ये आपको देख गया। और मैम इमेज आता है तो हम इमेज भी देख लेते हैं इसका। और इमेज भी जो आया था दैट वाज एक्चुअली द क्लासरूम इमेज, जो मैं हमेशा क्लास में शो करती हूँ, वही इमेज आया था इसका। वो मैं दिखाती हूँ आपको, ये देखो, द बाइटॉट स्पॉट्स का। ये नीट पीजी में भी आ चुका है, एफएमजी में भी आ चुका है, द सेम इमेज। बाइटॉट स्पॉट्स व्हाइट फोमी स्पॉट्स होते हैं, ट्रायंगुलर होंगे, एंड जो एपेक्स होगा इट इज ऑलवेज अवे फ्रॉम द कॉर्निया, व्हाइल जो टेरिजियम होता है दैट इज हैविंग अ एपेक्स टुवर्ड्स द कॉर्निया। ठीक है केपी, तो आई हैव शोन यू द इमेज आल्सो। ये हो गया इसका इमेज। अब चलते हैं आगे वाले क्वेश्चन, नेक्स्ट क्वेश्चन पे। ठीक है, coming to the next question, all of the following can invade the intact corneal epithelium except, so here the answer is pseudomonas। तो ये आपको याद करना पड़ेगा that there are certain bacteria जो invade कर सकते हैं, जिसमें Neisseria meningitidis आता है, Neisseria gonorrhoeae भी आ जाएगा, Neisseria gonorrhoeae, Corynebacterium diphtheria, Shigella है, उसके अलावा लिस्टेरिया भी होता है, और हीमोफिलस होता है। hemophilus, all these are important bacteria जो कि penetrate में हाँ बहुत बार आ चुकी है, और ये मेरी क्लासरूम इमेज है, मतलब रादर बाइट डॉट स्पॉट्स की यही इमेज मेरी फेवरेट है, मैं हमेशा यही वाली इमेज दिखाती हूँ क्लासरूम में भी, और यही वाली इमेज आई थी। तो ये सारे के सारे पेनिट्रेट करते हैं, स्यूडोमोनास पेनिट्रेट नहीं करता है। स्यूडोमोनास इज द most common infection in the contact lens users, in the contact lens users, most common infection contact lens users में होता है स्यूडोमोनास, जो कि इंटैक्ट कॉर्नियल एपिथेलियम को पेनिट्रेट नहीं कर सकता, बट इट इज द मोस्ट कॉमन इन्फेक्शन इन द कॉन्टैक्ट लेंस यूजर्स। ठीक है, ये हो गया हमारा नेक्स्ट क्वेश्चन। नेक्स्ट पे आ जाओ, द कॉमनेस्ट कॉज ऑफ हाइपोपियन कॉर्नियल अल्सर। What is the commonest cause of the hypopion corneal ulcer? So the most common cause of hypopion corneal ulcer में always remember the order. Order जो रहेगा इसका वो है the pneumococcus followed by the pseudomonas. ठीक है, तो whenever they are talking about hypopion, you will always have to choose the pneumococcus, and it is also having one more name. It is also called as the ulcus serpens. It is also called as the ulcus serpens. तो जब भी वो name use करते हैं hypopion corneal ulcer या फिर ulcus serpens, always take it as a pneumococcus. Then उसके अलावा always remember whenever we have bacterial hypopions. Whenever we are talking about the bacterial hypopion, सबसे पहले bacterial hypopion क्या होता है? Hypopion means pus in the anterior chamber. तो अगर bacterial hypopion है तो it is always sterile as well as always mobile. Then always sterile भी होगा और mobile भी होता है. Always sterile and always mobile क्यों? Because it has no hyphae. क्योंकि इसमें hyphae नहीं होते, finger like projections नहीं होते हैं. So whenever they are using the word hypopion corneal ulcer or they are using the word ulcus serpens, always and always remember that it is the bacterial corneal ulcer pneumococcus. ये अभी हमने पढ़ा था, what are the changes seen in the conjunctiva in the vitamin A deficiency. अगर विटामिन A का deficiency है तो हमको क्या चेंजेस मिलेंगे? अभी हमने पढ़ा, then it will be the hyperkeratosis of the squamous epithelium. Then it is the hyperkeratosis from non-keratinized epithelium. ये convert हो जाता है into the keratinized epithelium. From non-keratinized to keratinized. We can do K-Gurukul TND whole and can revise. Yes. चलो, तो अनदर ब्लॉकबस्टर क्वेश्चन जो आता ही आता है आप लोगों के पेपर में, रिकरेंट बायलैटरल कंजंक्टिवाइटिस है occurring with the onset of hot weather in the young boys and with the symptoms of burning, itching, lacrimation with polygonal raised areas on palpebral conjunctiva. इसका आंसर कौन देगा? ये क्या है? ये टिपिकल वर्नल केरेटोकंजंक्टिवाइटिस है, which is also called as the spring catarrh, which is also called as the spring catarrh. वर्नल केरेटोकंजंक्टिवाइटिस है जिसे कहते हैं स्प्रिंग कैटार. यस, ठीक है, तो ये हमेशा किस में मिलता है? यंग मेल्स में इट इज मोर कॉमन. यंग मेल्स में मिलेगा 5 to 15 years of age and recurrent होता है. ये रिकरेंट होगा, इंटरस्टिशियल होगा एंड टाइप 1 हाइपर सेंसिटिविटी रिएक्शन होगा, दैट इज IgE मीडिएटेड. IgE मीडिएटेड होता है and also it is a exogenous allergy. Very very important. Exogenous kind की एलर्जी होती है and it is found in hot and humid climate. तो जब भी ये सारी चीजें मिलेंगी, ऑलवेज रिमेंबर अबाउट द वर्नल केरेटोकंजंक्टिवाइटिस एंड दीज पेशेंट्स विल ऑलवेज प्रेजेंट विद टू थिंग्स, बहुत ज्यादा इचिंग होती है, इंटेंस इचिंग. We will have the intense itching and also we will have the ropey discharge. ropey discharge कह सकते हैं या फिर stingy discharge. ropey discharge या फिर stingy discharge. I have a question. Pseudomonas can penetrate the cornea. So where were you? We have just discussed this question. So afterwards you can rewind this and see. Then the signs may you have very typical cobblestone appearance. Cobblestone appearance. We have just discussed that Pseudomonas cannot penetrate the intact corneal epithelium. It is wrong. ठीक है? Cobblestone appearance होगा. Then we very typical get the Horner Trenta spots. Horner Trenta spots मिलेंगे. These are the collections of the eosinophils. These are the collections of the eosinophil cells along with this is found in conjunctiva. उसके अलावा we will also get the shield ulcers. We will also get the shield ulcers in the cornea. And what is the treatment to complete the topic? Treatment कौन बताएगा? Tell me just one time, last time. So no, Pseudomonas cannot penetrate the cornea. ठीक है? Treatment of choice is olopatadine. Olopatadine. Olopatadine है. If this is not working, then we will give the steroids. So very important है. इसीलिए I have told you the whole of the topic because most of the time we are getting one question from this VKC. ये देखो, there is a direct question, which of the following does not cause the hemorrhagic conjunctivitis? So here the answer is papilloma virus, enterovirus. So actually most commonly it is caused by the picoRNA virus family. RNA virus family. Most commonly it is caused by the picoRNA virus family, especially the enterovirus, type 70. So one is this. Then we have adenovirus and the pox virus. So basically that is why papilloma virus is not the answer. And only bacteria which produces the hemorrhages, only bacteria which can produce hemorrhages is the pneumococcus. Only bacteria which can produce the hemorrhages is the pneumococcus, which can produce the small pinpoint hemorrhages. Now who will tell this? What is the treatment of choice for the angular conjunctivitis? Angular conjunctivitis is caused by the Moraxella Axenfeld bacteria. Moraxella Axenfeld, and it releases a proteolytic enzyme. This proteolytic enzyme will cause the eczema or the dryness. And that is why we give zinc as the treatment of choice, because zinc will help in epithelial healing. That is why the treatment of choice is zinc. Even the etiology is also important. So another important thing is the angular conjunctivitis. Now these notes of cornea and conjunctiva also you will get in the file section of my Telegram group. This is the name of the Telegram group and this is my Insta profile. Okay, when you will go to this group, in the file section you will get the notes of cornea and conjunctiva. All of them are very important, very crisp. You can just download that and you can read the cornea and conjunctiva from there. Next है, we have a 28 years old male है, complaining of glare with the burr-like opacities in the epithelium. Then long-term treatment with the amiodarone है. So first of all we have glare. Glare क्या होता है? It is the light sensitivity. लाइट सेंसिटिविटी हो रही है पेशेंट को, whenever we have some problem in the cornea we can have this light sensitivity. मैककेली कॉफमैन मीडियम इज यूज फॉर कॉर्नियल ट्रांसप्लांटेशन के लिए यूज करते हैं, ठीक है. सो वी आर हैविंग दी वॉल लाइक डिपॉजिट्स विद द एमिड्रॉन. सो आंसर टू दिस क्वेश्चन इज कॉर्निया वर्टिसिलेटा. सी नहीं है, दैट इज अ डिफरेंट थिंग. ये होता है कॉर्निया वर्टिसिलेटा. कॉर्निया वर्टिसिलेटा which is also called as the vortex keratopathy. Also called as the vortex keratopathy. Cornea verticillata or the vortex keratopathy will be due to certain drugs. इसके लिए भी एक mnemonic है pica. The eating habit of non-edible things, है ना. तो when you see the patient is taking the phenothiazines, एक तो हो गया phenothiazines, then we have the indomethacin, then we have chloroquine. Very easily you can remember the mnemonic. And then we have A for amiodarone also. We have amiodarone. So these are the 4 most important drugs which can cause this cornea verticillata. Verticillata क्यों कहते हैं? क्योंकि vertical lines हो जाती हैं. These are the 4 important drugs. उसके साथ it is also occurring due to the nitarsudil. Nitarsudil important है because it's a new anti-glaucoma drug. ये आती है rho kinase inhibitor में. तो क्योंकि it's a new drug, this can be asked from you people. Rho kinase inhibitor से याद करो. उसके अलावा it can also occur due to the Fabry's disease. ठीक है ना. Carry. अच्छा, this was there in the questions. All right. ठीक है, all these are there. Next देखो, a patient is presenting with a history of chuna particles falling in the eye, then which of the following should not be done? क्या नहीं करना चाहिए? So it is the slit lamp examination. See, whenever we have chuna particle injury, it's a alkali injury, that is a chemical injury. तो अगर केमिकल इंजुरी है आई में, व्हाट ऑल यू शुड डू? नंबर 1, आई विल डू द इरिगेशन विद द नॉर्मल सेलाइन, क्योंकि वी वांट टू वॉश अवे द पार्टिकल्स. वॉश कैसे करेंगे? बाय द नॉर्मल सेलाइन. उसके बाद नंबर 2 पे हम करते हैं डबल इवर्जन ऑफ द आईलेट्स. डबल इवर्जन ऑफ द आईलेट्स क्यों करेंगे? डीपली एम्बेडेड पार्टिकल्स को रिमूव करना है. उसके बाद नंबर 3 पे हम करते हैं डिब्राइमेंट. नंबर 3 पे we do the debridement. debridement क्या होता है? रिमूवल ऑफ द डेड टिश्यू. सबसे पहले हमने वॉशिंग कर लिया, वॉशिंग करने के बाद डीपली एम्बेडेड पार्टिकल्स रिमूव कर लिया, डेड टिश्यू रिमूव कर दिया. उसके बाद हम सोडियम सिट्रेट ड्रॉप्स देते हैं. और हम क्या दे सकते हैं इसमें? टेट्रासाइक्लिन. टेट्रासाइक्लिन दे सकते हैं या फिर टेट्रासाइक्लिन ग्रुप ऑफ ड्रग्स लाइक डॉक्सीसाइक्लिन भी दे सकते हैं, बिकॉज दे हेल्प इन प्रिवेंटिंग द परफोरेशन. व्हेनेवर वी हैव एल्कोहली इंजुरी वी हैव ऑलवेज द रिस्क ऑफ परफोरेशन. तो उसके लिए हम सिट्रेट दे सकते हैं, डॉक्सीसाइक्लिन दे सकते हैं. क्या नहीं करना है स्लिट लैम्प एग्जामिनेशन? बिकॉज इट इज अ टाइम फॉर डूइंग, नॉट फॉर एग्जामिनेशन. इट्स अ वेरी पेनफुल कंडीशन है, बहुत सीवियर कंडीशन है, परफोरेशन हो सकता है. तो यू आर नॉट जस्ट गोइंग टू हैव द एग्जामिनेशन एट दैट टाइम. ठीक है ना. तो वेरी वेरी इंपॉर्टेंट है. ऑर्डर भी इंपॉर्टेंट होता है, इसीलिए आई एम टेलिंग यू द ऑर्डर ऑल्सो. फर्स्ट इज द वॉशिंग, सेकेंड इज डबल इवर्जन, थर्ड इज डिब्राइडमेंट एंड देन इज द ड्रग्स. नेक्स्ट पे आ जाओ, हर्बर्ट पिट्स. ये भी बहुत बार पूछते हैं. हर्बर्ट पिट्स मतलब होल ऑफ द ट्रैकोमा आपके लिए इंपॉर्टेंट है. यू हैव टू रिमेम्बर एवरीथिंग अबाउट ट्रैकोमा. पूरा का पूरा ट्रैकोमा पढ़ना है. इसका दूसरा नाम क्या होता है? इजिप्शियन ऑफ्थेल्मिया. It is also called as the Egyptian ophthalmia, and basically it is caused by the chlamydia. ये किससे होता है? Chlamydia trachomatis. Chlamydia trachomatis से होगा, which is actually a obligate intracellular parasite, and this is giving you the HP bodies. Name of the bodies भी इसमें important होता है. Albert Streeter Provozic bodies. Albert Streeter Provozic bodies. फिर हम इसको डिवाइड कर सकते हैं. इसको हम डिवाइड कर सकते हैं 2 सब स्पीशीज में, A, B, BA, C and then we have D2K. उसके बाद D2K रहता है. तो AB एंड सी से होता है द ब्लाइंडिंग ट्रेकोमा, जिसको हम ब्लाइंडिंग ट्रेकोमा कहते हैं, which is responsible for blindness, while D2K is responsible just for the inclusion conjunctivitis. This is responsible for the inclusion conjunctivitis. Then coming to the signs. Signs ध्यान से देखो, एक तरफ हम लिख रहे हैं कंजंक्टिवा के साइंस और एक तरफ हम लिखेंगे कॉर्निया, ठीक है। कंजंक्टिवा में क्या क्या मिलेगा, वेरी वेरी इंपॉर्टेंट, द सागोग्रेन फॉलिकल्स। सागोग्रेन क्या होता है गाइस, सागोग्रेन फॉलिकल्स मिलेगा। सागोग्रेन क्या होता है, एंड देन वी ऑल्सो गेट दी पैपिलरी हाइपरप्लेजिया। दो वेरी वेरी इंपॉर्टेंट साइंस इसमें मिलते हैं, इसीलिए इसको मिक्स रिस्पॉन्स भी कहते हैं, क्योंकि यहाँ पे फॉलिकल्स भी मिल रहे हैं और पैपिलरी हाइपरप्लेजिया भी मिलता है, और उसके बाद स्कारिंग हो जाती है। तो स्कारिंग को हम बोल देते हैं आर्ट्स लाइन, स्कारिंग मिल जाती है, स्कारिंग को हम बोल देते हैं आर्ट्स लाइन, और जो रह जाता है स्कारिंग के बाद डेब्री, उसे बोल देते हैं कॉन्क्रीशंस। तो ये 4 इंपॉर्टेंट होते हैं कंजंक्टिवल साइन। सागोग्रेन क्या होता है, साबूदाना। जब हम साबूदाना को बॉईल करते हैं तो पर्ल लाइक अपीयरेंस होती है, वैसी पर्ल लाइक अपीयरेंस वाले फॉलिकल्स होते हैं सागोग्रेन फॉलिकल्स। पैपिलरी हाइपरप्लेजिया, आर्ट्स लाइन में स्कारिंग मिलेगी एंड कॉन्क्रीशंस मिलते हैं। जबकि कॉर्निया में हमको मिलता है हर्बर्ट। अब हर्बर्ट के ही नेम से फॉलिकल्स भी मिल जाते हैं और हर्बर्ट के नेम से ही पिट्स भी मिलते हैं, एंड ये हर्बर्ट फॉलिकल्स सेम होते हैं सागोग्रेन फॉलिकल्स, लेकिन यहाँ पर पिट्स मिल रहे हैं। दीज वर नॉट फाउंड इन कंजंक्टिवा। ऐसा क्यों है, क्योंकि कॉर्निया एवास्कुलर होती है, इसीलिए यू गेट द हीलिंग डिफेक्ट्स। उसके अलावा यहाँ पर हमें कॉर्नियल अल्सर मिल सकता है, जिसको हम पैनस बोलते हैं, कॉर्नियल अल्सर विच इज कॉल्ड एज द पैनस। देन वेरी वेरी इंपॉर्टेंट इसके लिए जो होती है, दैट इज योर सेफ स्ट्रैटेजी। अगर मैं यहाँ पर ट्रेकोमा को कंटिन्यू लिखती हूँ, तो ट्रेकोमा में एक इम्पॉर्टेंट चीज होती है, एक तो WHO स्टेजिंग। WHO स्टेजिंग का जो नेम होता है फिस्टो क्लासिफिकेशन। इस फिस्टो क्लासिफिकेशन में हमारा हो गया F फॉर फॉलिकुलर, देन वी हैव I फॉर द इंटेंस इन्फ्लेमेशन, इंटेंस इन्फ्लेमेशन हो गया, देन S फॉर स्कारिंग है, then we have got T for trichiasis हो गया, and then we have O for opacity, opacity of the cornea, ठीक है। दिस इज द WHO स्टेजिंग। उसके अलावा वेरी वेरी इंपॉर्टेंट होती है इसके ट्रीटमेंट के लिए सेफ स्ट्रैटेजी। इसको ध्यान से देखना, सेफ स्ट्रैटेजी पर भी क्वेश्चन आ जाता है। सेफ स्ट्रैटेजी में हमारे पास हो जाता है सर्जरी, देन A फॉर एंटीबायोटिक्स, then we have A for antibiotics, and always remember surgery we are doing for the trichiasis. Surgery we are doing for the trichiasis. Then we have A for antibiotics, F for the facial cleanliness, for the facial cleanliness, and then we have E for environmental hygiene. E for environmental hygiene. So whole of the trachoma is very very important, and that is why I have discussed this as a topic whole. A patient is coming with diabetes and hypertension with diminution of vision, flame-shaped hemorrhages and cotton wool spots. So this is the hypertension retinopathy. Hypertension retinopathy KP, and in order to say which grade it is, so we should be knowing about the silver wiring, copper wiring, we should be knowing about Salus sign, we should be knowing about gun sign, bonnet sign, papilledema, only then we can say which stage it is. Is this clear? Harshish, for which beta you are saying PDR? So whole of the trachoma I have discussed. I hope you have understood this. Then see another important thing, the cataract. Cataract in the diabetic patients is because of the sorbitol accumulation. What is the enzyme responsible? Aldol reductase. Again, a very very frequently asked PYQs adult is the aldol reductase. Whenever we are talking about the diabetic patient, what is the most common cataract? The most common cataract in diabetes is the pre-senile cataract, most common. But if they are asking you the most specific is the true metabolic, then it is the true metabolic cataract, that will be called as the snowflake cataract. That will be called as the snowflake cataract. So in this snowflake cataract, we have the sorbitol pathway, and the most common presentation here will be the fluctuation of the refractive error. So all these things are important: fluctuation of refractive error, snowflake cataract, which is a true metabolic cataract, while the most common is the pre-senile. Don't say snowflake cataract is most common. Most common is the pre-senile cataract. Okay? Then coming to the next one, what is the most important factor in the prevention of the post-operative endophthalmitis? Yes, so it is a pre-operative preparation with the povidone iodine. See, whenever we are having the post-operative endophthalmitis, it is actually the bacterial endophthalmitis. It is the bacterial endophthalmitis. Bacterial endophthalmitis. So we have got the maximum risk. Maximum risk is from the patient's own flora. Maximum risk is from patient's own flora, and therefore this will be the best prophylaxis. The best prophylaxis that you can give to prevent this bacterial endophthalmitis is the 1 drop of povidone iodine. And how will the patient present? So patient will actually present with the sudden and the painful diminution of vision. And but of course we will have the redness also, and this will happen after the initial improvement. One time there will be improvement because patient has already done with the cataract surgery. Now due to the endophthalmitis, again we will have this pain and redness, diminution of vision. You can see hypopyon in the patient. Hypopyon can also be there. Now what about the etiology? So if they ask you about the etiology of the endophthalmitis, then always remember you have to see the onset. Is it the early onset or is it the late onset? Now, what is the criteria of early? Early means less than 3 weeks and late is 3 or more than 3 weeks. This is the criteria for the early and late. Early के लिए it is the staph epidermidis. Staph epidermidis is the one with the early onset. Late may we have the Propionibacterium ignis. So whenever they are asking you the question related to the etiology of the endophthalmitis, go according to this. All right. Next question, again a very important question. This is the 55 years old patient having diminution of distance vision, but he is not requiring the near glasses for the near work. What is this? Any answers? Evisceration is removal of which layer of the eyeball? So it is the scooping out the inner contents of the eyeball where the sclera will be spared. That is the main thing. If I am doing evisceration, then the sclera will be spared. While when I am doing the enucleation, then I am removing whole of the eyeball along with a part of optic nerve. Okay. This is there. Yes, so here the answer is the nuclear sclerosis. Now what happens in the cases of nuclear sclerosis or the nuclear cataract? Whenever we have nuclear sclerosis or the nuclear cataract, we will have hardening. That is why it is called as sclerosis. Due to the hardening, there is the increase in the refractive index. And due to the increase in refractive index, patient develops myopia. This myopia is called as very correct, Harshesh. It is the index myopia, and rather this index myopia was recently asked also. This index myopia was asked in the NEET PG 2023. So I seriously hope that this question, similar one, can come to you also. Due to the myopia, there will be diminution of vision for the distance. there will be diminution of vision for the distance, plus there will be improvement of the near vision, plus there is improvement of the near vision. So there is a diminution of vision for the distance, but myopia is a short sightedness, and due to the short sightedness there is an improvement of near vision, and therefore it is called as the second sight. So this patient will not require the near glasses for the near vision. So it looks as if there is a miracle or a second sight which has developed in the patient. Second sight be important in nuclear sclerosis and index myopia. Very, 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 very important. Okay. Next है best accounted function of MIP 26 in lens. So it is maintaining the lens transparency. See, whenever I am talking about the lens transparency, what all are the causes for the lens transparency? Because you know the main physiology of the lens is the vision refraction. For this it requires transparency. So number one is the avascularity. Lens is the avascular, therefore it is transparent. Then its crystalline nature, because of its crystalline nature also it is transparent. It is having the proteins crystallins. It contains the proteins, that is the crystallins, and these crystallins are of three types: alpha crystallins, beta crystallins, as well as gamma crystallins. Alpha crystallins are largest in the size and the beta will be most common. Then number three, we also have the relative dehydration. Lens will always remain in a state of relative dehydration. This relative dehydration is due to the sodium potassium pump. Relatively dehydrated state में due to sodium potassium pump which is present in the cortex of the lens. And then 4 is this MIP26. What is the meaning of MIP26? This is the major intrinsic protein. This is the major intrinsic protein. So these are all the causes for the lens transparency. And then the next one, which of the following is not needed for the IOL power calculation prior to the cataract surgery? Prior to the cataract surgery, what is not required is the corneal topography. See, whenever I want to calculate the power, what I require first of all is the biometer. The name of this machine is called as biometer, and the formula that we are using is the SRK formula. The formula that we are using is the SRK formula, where formula says that P is equal to A minus 2.5 L minus 0.9 K is there. So P is the power here. So power ke liye we require this, and here A will be the IOL constant. A will be the IOL constant, L will be the axial length, and then is the K. K will be the corneal curvature. K is the corneal curvature. Now for calculating the corneal curvature, we require the keratometer. So I require keratometer, biometer, I require SRK formula as well as the A-scan ultrasound. For axial length, we require this A-scan ultrasound. And here A means the amplitude. A means the amplitude. So this is actually the one-dimensional ultrasound. It is only a one-dimensional ultrasound, and it is seen in the form of spikes. We do not see the 2D picture. You are not seeing the 2D picture of the eye. It is a one-dimensional ultrasound. All these things we require. So what you not require? Keratometry, biometry, A-scan, SRK formula. So what you not require is the corneal topography. Then the last one, the component of the eye which has the maximum refractive index, it is the center of the lens. See, when I am talking about the surface, surface is the cortex. Cortex is 1.39. When I am talking about the center, center is the nucleus. Nucleus is equal to 1.42. Cornea is 1.376. While aqueous humor will be equal to that of the vitreous humor. So this is giving you 1.33. So when I am comparing the refractive index of the different parts, maximum is found in the center of the lens. So basically there are three things. One is this refractive index, then one is the refractive power. When I talk about the refractive power, then the total is plus 60 diopter, and this plus 60 diopter can be divided into cornea as well as lens. Cornea will give me 43 to 45 diopter, and 15 to 17 diopter will be the lens. So one is refractive index, one is refractive power, and then third is the refractive surfaces. So there are total 4 refractive surfaces. Like we have 2 of the cornea, and then we have 2 in the lens. 2 in the cornea we will have, and 2 in the lens we have, and it is actually the anterior surface of the cornea that will be the most important refractive surface. So the maximum refractive index is found in the center of the lens, maximum power is in the cornea, and the most important refractive surface will be the anterior surface of the cornea. So this is all for today, guys. Whatever topics that I have given you the questions, these are all the important topics. Try to revise them as many times. And for your convenience, I have already shared the PDF of the cornea and conjunctiva notes in the file section of my Telegram group. You can go and download from there. I'll try to share this PDF that I have discussed today, and will let you know. For any queries, you can always DM me, or you can ask on my Telegram group. You can follow on the Insta, or you can ask on the any other social media handles. So take care, keep on studying, all the very best, and happy ophthalmology.